Diversity. Without further ado, welcome Dr. Brown.
Hey y'all. Like she says, I am Z, Dr. Tiana Brown, the occupational therapy extraordinaire. That's how I like to do that, or introduce myself as your friendly neighborhood occupational therapist and lymphedema specialist. So let's talk about lymphedema. Let's dive right in. So, of course, it is a very, very, very intricate system. The lymphatic system is. I'm not going to break down all the science, but I do want to give you some tools, some ideas so you can know what's going on with your body. And also, if you to advocate for yourself or for other people as well. So, a little bit about me. That is me. That's one of my favorite pictures because I feel like that's the best depiction of what occupational therapy is. As an OT, we learn so much in our 3 to 4 years, depending on which program that we're in our curriculum, that we could balance in pelvic floor, pediatrics, hand therapy, vision therapy, lymphedema, orthopedics, neuro, and we learn it all under one roof, and it's all within our scope of practice. And so that's what I love about OT. I get to pretty much pick, choose, and refuse what I want to do and what I'm able to do, and really build to my scope. So, like she said, I got my degree at exercise science. Lord, I got my degree at USC. Go Gamecocks! At USC, and then my master's at UND, University of North Dakota, because stationed there with sweet loving husband, and ended up going to one of the best OT schools out there, and then Creighton University. Um, got my doctorate at Creighton University in Omaha, Nebraska, which is again one of the best OT schools out there too. So, but I'm certified in a multitude of things. So definitely lymphedema therapy, which I've been a lymphedema therapist honestly since I started OT school, because I'm very, very passionate about lymphedema, and pelvic floor therapy as well, LSVT protocol, interacting metronome, which is something that I use for some of my neuro kiddos, and just working with across the lifespan. And so as of right now, like you said, I'm currently in Delaware, Dover, Delaware. I'm married to wonderful husband of almost 11 years, Myron Brown. He is in active duty Air Force. And so with me having this degree and this ability to bounce around the way he bounces around, I get to do different things in different facilities. So if I need to work in a school, if I need to work in a transitional home, if I need to work in a skilled nursing facility, a hospital, outpatient, I can do all of those things with this one degree. So shout out to anybody who's an OT or who wants to be an OT. Come talk to me. I'm all about it. But currently working in outpatient therapy, and I'm also a facility instructor with the Academy of Lymphatic Studies. That's AKA ACOL. So I actually teach and certify other professionals to be lymphedema therapists as well. And not just therapists as in PT and OT, but I taught chiropractors, massage therapists, nurses, RNs, nurse practitioners, and PAs. So if you're interested, holla at me. But I'm also LANA certified, so that means I am double board certified, kind of cool, in lymphology studies, and of course with my board certification with occupational therapy. So I can have these conversations with you guys, but I can also have these conversations with plastic surgeons, oncologists, vascular physicians and providers, wound care, things like that, to help move and promote the proper care of all things dealing with the lymphatic system, not just lymphedema, but CVI, which is chronic venous insufficiencies, arterial issues, and even lipedema. So a little bit of me. So I'm moving, but let's talk about it. Lymphedema. So lymphedema is considered a protein-rich swelling. This is not a swelling that when you have a really good, margarita and some chips and some really delicious salsa, and you kind of, ooh, those pants are feeling a little tight and a little uncomfortable. Yes, that swelling can happen. That's more of a dynamic swelling, what we like to call it, and that's just regular edema. Lymphedema is a protein-rich swelling. So that's why it doesn't just go down with only elevation or only drinking water and maybe taking diuretics. I don't know if some of your doctors try to prescribe you diuretics to help with lymphedema. That doesn't help. So we'll talk about that. And lymphedema is a disease process. We kind of go through here so I can show everything. So it is a disease process. So this is a chronic condition. This is a disease. This is something that does not just go away. It is not a symptom. It is a disease. So when you have lymphedema and your provider says, oh, all you got to do is take this diuretic and drink some water, you'll be fine. Not so. This is something that is affecting a major part of your circulation system or your circulatory system. So it is a abnormal accumulation of protein and water in the interstitial space. And so as you can see in this picture, if you can see, it's a little bit of a, it's a leg here, and then a swelling, you can see a little bit of that extra fold around the ankle and the swelling at the top of the foot. So this type of swelling you can have this type of swelling in your extremities, either in your upper extremities and in your lower extremities as well. And this is considered a mechanical insufficiency of the lymphatic system. So this means that there's something wrong with the actual setup of your lymphatic system. Something was traumatized, something was changed, something was altered. So this is not just a symptom, this is a condition. So when we think of edema, swelling, due to eating something really salty or, having certain conditions or hurting yourself, hitting the area, just a swelling that just kind of goes away, you elevate it, you're fine. That is a dynamic insufficiency. So you think of edema, ED, mechanical insufficiency, mechanical L or LM. So that's how I usually kind of teach in my class, that you make a connection there. So you can get this down. Even though I like seeing your faces, I don't want to block any information here. Edema versus lymphedema. Edema is just the swelling of tissues of excessive fluid in the distal tissues, like in the feet and the ankles and the hands. So again, possible causes: gravity, poor nutrition, too much salt, even allergic reaction, side effects of a medication, and is usually reversible. With lymphedema, this is a chronic dysfunction of the lymphatic system and an accumulation of the lymph fluid in the tissues. And so if you think about it, the lymph system is literally skin deep. Like if I'm able to just pull this, the lymph system is literally right underneath the skin. And so when you have that swelling and that just stays, especially with that protein-rich fluid, it keeps the nutrients and the healing process from happening the appropriate way. So that's why a lot of our patients that end up having lymphedema and having that chronic swelling end up having chronic infections. And we'll talk more about that too. So again, lymphedema is the protein-rich fluid that settles in the tissues of the limbs that causes the swelling and the fibrosis of the skin. And that is what lymphedema does. It changes your skin consistency. Your skin is supposed to be, you're supposed to have a little wrinkle. I know everybody gets scared about wrinkles, but wrinkles are really, really good when it comes to lymphedema. If you're able to pinch and pull and separate, that means that the skin is supple and it's able to bounce back and fight what it needs to fight. If it's chronically swollen, it gets to the point that it changes the chemistry and the makeup of the skin, which makes it very, very fibrotic and very easy to cause infection. So it's a little blurry, but as you can see on, I don't know my right and my left, so it's the opposite here. It's the right side here. It has healthy lymphatic tissues. You see the surface of the skin and you see the lymphatic vessels. Like I said, they're right below the skin. And then underneath here, this is where they flow and go. And the system is actually an open system. It doesn't flow, it flows with the venous and the arterial system, but it doesn't have a closed system. Like, if you have what happens when if your arteries are open? that means you're bleeding out. That means that's a hemorrhage. So your venous system and your arterial system is closed. It goes and flows. But with the lymphatic system, it goes with it, but it flows alongside of it. So there's always fluid just floating in the space. So if it's too much and it ends up being malformed, the lymphatic system is either malformed or damaged, the fluid just builds up and ends up getting bigger and bigger. And as you can see, the surface of the skin is affected as well. And it actually lifts up. That's why you have the skin changes. That's why it gets hard over time. And even sometimes it can feel like the back of an orange, like, you know, the orange peel skin. That is what the lymphatic system can do. It just sits and settles in that skin. Okay, this is my soapbox. Lymphedema is not traditional fat. I cannot stand it when my patients go to the doctor or go to their provider and they say, oh, you just need to lose weight. Fine, everybody can lose weight. It'd be very, very helpful. But obesity and lymphedema actually are run together and they actually are affected by each other. But having lymphedema does not mean that you are obese. Having lymphedema means you have a chronic condition of the protein-rich fluid. And I cannot stand, let me go ahead and look at everybody's face right now. Who loves the BMI chart? Right? Who hates the BMI chart? Right here. The BMI chart is inherently biased, a little racist, and just it doesn't include anything that goes on. It doesn't include your dense breast tissue. It doesn't include your DEXA scan things. It doesn't include anything that it just heightened weight. That's it. And so when your doctor, when you go into the doctor's office and they say, okay, you're obese because of your BMI, it's like, not, have you checked anything else? Is anything else able to suffice? Okay, well, why am I heavier here? Protein is actually almost heavier or the same weight as fat and a little bit heavier than muscle at times, depending on how it accumulates. And so none of that, the part of the body composition, because it's supposed to be body, you know, the body index, but it doesn't talk about the composition of everything else that makes up your body. So I want you to throw that out the window. I want you to understand that when you have lymphedema, when you have this chronic swelling, yes, you will be heavier, but it does not make you obese. But then at the same time, if your leg or your arm is heavier than usual, that makes you less motivated to do anything, which in turns into having more of a sedentary diet, which in turns into you having pain, which in turns into you getting more static and having more stasis, which provokes further adipose accumulation, which causes increased limb stasis, and then that causes the obesity. And so I want you to know and understand that you are not your BMI number. I want you to let that go. I know they need it for objective measures, but people are getting services that are not even getting services, are getting delay of service because of a BMI number, because they don't actually check them. They don't actually physically feel the person. Like I'm a therapist that I like to put my hands on you. I don't like to just put you on a machine or give you exercises and you keep it moving. I like to feel things. I like to smell you. You hear me? I'm that type of person. I had a patient yesterday, post-op, she's a lymph patient. She's post-op, 3 weeks, was tummy tuck. And she's been doing great, but underneath her right breast, she keep having this little small pinhole with the sutures kept poking through. And I kept pulling the suture. I would check it every time. She would say, I already checked it, I already changed it. Nope, let me see it. Keep doing that. And then yesterday I saw her, I was gone for a week, came back, and it was 2 centimeters open, wide open. All the doctor told her was to just keep putting Silvadine on it and you're fine. Smelled it, smelled like it had an infection, told her to go to the emergency room or to the urgent care as soon as possible to at least get started on some type of, to get checked out and to get started on some type of antibiotic. I was able to help her go from one place to the other, even though she sent the doctor pictures and everything else. it's just not good. So I don't like to just sit there and be like, oh, you're fine. Oh, you're just this way. Oh, that's just how your mom, and then we're made up. No, let me feel you. Let me see you. Let me see where your pain is. Let me see what's the difference between lymphedema and lipedema, which is a whole nother thing too. So that's my little soapbox. Soapbox is off now. So I like to say that. So you are not your BMI number. So now there is a difference between primary lymphedema and secondary lymphedema. So when you think of primary, it's latent or born with it. Maybe it's Maybelline. No, you're born with it. Okay. So there is no event, no surgery, no trauma that triggers it. Primary lymphedema is when you were born with a malformed lymphatic system. And research and significance usually shows that it usually ends up happening. You end up noticing a difference in your limb, whether it be your lower extremity or upper extremity, or even around your abdomen, at a significant change, at a hormonal change at birth, puberty, pregnancy, or menopause. Because some people are born with very small lymphatic collectors, which make it hard for the lymph fluid to flow through the open system, or a large, or they're too big. It's just too much lymph going through, and they're not properly having the channels to slowly filter the lymph through. Or some were born with none, and the system's not able to work properly. So secondary lymphedema, or anybody that had any type of cancer, surgery, radiation, infection, even parasites. And I'm going to go specifically in the next couple slides for the triple negative girlies too. But so I want you to know that sometimes, I don't know if you ever noticed that, maybe around puberty, for the women that are on here that have their cycles, that maybe you notice the difference in, maybe one breast being bigger than the other, maybe one arm being bigger than the other. And it's like, why is this happening like this? And it didn't bother me before, but there is a lot of research now. They're trying to get more focus now on primary lymphedema patients, because there are a lot more cases now, that the hormonal change, there's something in the estrogen and progesterone that causes this change, causes this increase of protein production, and messes with the lymphatic system. But normally you were already born with it. So some of them cute, chunky babies that have all those rolls, it's like, oh, you're so cute, you might have primary lymphedema. It's so bad. But that's what I'm thinking. It's like, oh, like, yeah, the rolls are cute, but let me check those rolls. Let me pinch. Let me do assessment. So now learning about this has totally just changed my whole mindset when it comes to, swelling and things like that. So secondary is what you see for the most part. Anybody that's that dealt with cancer, the surgeries, and radiation, and even chemotherapy, they are at a higher risk to getting lymphedema. And that is what really puts lymphedema on the map, which is, unfortunately, breast cancer survivors. So my story, that I learned that I had primary lymphedema. So my mom was diagnosed with breast cancer at the age of 21. She's still here with us. She's thriving and she's doing great. But she underwent chemotherapy and surgery, became pregnant with me at 24. And I was born with elevated blood sugars, had tubes in my head and everything else, to try to help regulate my system, which is kind of funny, which is, I have like shaved sides here. I didn't realize now, always making those connections. They had to shave my head into like a mohawk. And so my hair always grew like that. I always had like shorter sides, and then this long piece will end up looking like Sonic the Hedgehog. So I was like, you know what, let me just embrace it and just cut it off and just do that. So interesting. But anyways, but I was taller and bigger than some of my classmates. When puberty hit, my breasts were larger and my arms ended up being larger, but stayed the same size, no matter if I gained weight or lost weight. So I've always had bigger arms here, but they would always just stay the same. So I didn't realize I had primary lymphedema until my mid-20s, when I learned about it, just about lymphedema period, in my studies. And so learning like, okay, is this a genetic component? Is this hereditary? Is it because maybe the chemotherapy and the medications and the steroids that she had to take because she didn't know that she could get pregnant and she became pregnant. And as far as I know, she didn't do chemotherapy while I was in utero, but just having all of those things and all of that, having her environment and my environment literally, tainted in a way, did that cause it? And was I born with it that way? Is it medication induced? Was it certain things that caused that? And so I say all that too about learning about the studies too, is that I learned about it in my studies because I'm interested in it. I found out that only that when it comes to medical school, the people that go to school for 4 years, they have maybe one lecture about lymphedema and about the lymphatic system, period. That's it. They have to do extra training and do extra work in a wound care, vascular, or a lymphedema clinic to get that extra training. We learn about this stuff out the gate, and the extra training I had to take at least 3 or 4 classes. I learned about lymphedema in a whole semester. And so when you have a certified lymphedema therapist, they went to school and focused on this and know the lymphatic system inside and out. And so it's very important for you to know who your person is, meaning your your lymphedema therapist, so they can go to bat for you, so they can get you the right compression, the right pump, the right doctor. They might need to say, okay, hey, you may have lost some weight or we may have gotten some lymph system moving. Now you have, access skin. Okay, we have to send you to the right surgeon to do that, because not every surgeon goes meticulously around lymphatic system whenever they're doing these liposuctions, these the mommy makeovers, or even just surgery. Period. I've had people that had lymphedema that end up getting lymphedema from knee surgeries, just from doing that. So it's very interesting. So my triple negative ladies. So there are cancers that can cause lymphedema, breast cancer, lymphoma, uterine cancer, melanoma, and prostate cancer, even head and neck cancer. As you can see, the woman here has her lymph nodes in the main places. You have over 600 to 700 lymph nodes in your entire body, and those cannot regenerate. And so whenever you have an unfortunate event like cancer or any type of infection that they have to take out lymph nodes, the main collection of them are in your neck, under your arms, in your belly, and then also in your inguinal areas. Those are where the main source of your lymph nodes are. So if any of those are attacked or damaged, and or have to be excised or taken out, the lymph system has no other place to go unless it is helped and rerouted along with the what you call the anastomosis. But it's a disrupted lymph flow, and then that ends up building up in the tissues. So that's why when you have the cancers, when you do have the lymphectomies, the doctor should automatically send you to a lymph clinic or a lymphedema specialist so you can get the help that you need. There are different stages, as you can see here. I have one here that, the lumps around the region, around the groin region are caused by swollen lymph nodes. That's from some of our ladies that, or men that may have had the triple negative, and then they end up wanting to do the full mastectomy and the hysterectomy or prostectomy to take out everything and the surrounding lymph nodes to keep that cancer from spreading. And so if you can imagine you're having swollen swollen growing area, or those lymph nodes are taken out, that tissue and that pressure is just going to stay there. And so you can have lymphedema in your labia. You can have lymphedema, you know, swollen right, in that area there. So there are so many ways that you can help with decreasing that pressure and that tension while doing certain massages, even wearing the proper compression. Different stages of lymphedema. So stage 0 and stage 1 are the only ones that are reversible. So Stage 0 is when you know you may have it, you barely see any type of swelling. You may see just very, very little skin changes. It may take a lot longer for you to reduce some of the swelling, but it's nothing that's too noticeable. Stage 1, as you can see in this picture, the skin starts to change. It's a little bit darker towards the extremities because the smaller the areas, the smaller the lymphatic vessels are, and they just sit and settle in the tissues. And then it starts to change. So then after stage 2, the limb gets bigger and then the skin gets more fibrotic. You end up having harder skin. It doesn't moisturize well. You have to get um, a thick moisturizer, and it's supposed to be a low pH moisturizer to go on the skin, and like a thick cream to help keep the skin nice and moist. And then stage 3 is the irreversible stage where you can see the limb is significantly larger, which means it's heavier. And so there's so many things that can add to it. So if you have lymphedema of your upper extremity, if you can see in stage 2 and stage 3, if you can imagine how heavy her arm is just hanging down there, don't you think she probably has back pain, neck pain, may even have to have issues with her surgery or therapy on her rotator cuff because of all the pulling and things. So there's so many secondary things that can happen with just a heavier limb. And it's nothing that you did, it's something that happened to your body. And lymphedema is always asymmetrical. There's always one side bigger than the other. Sometimes, unfortunately, you can have bilateral lymphedema on your extremities, whether it be arms or legs. And you can even have growing head and neck. I've seen patients that unfortunately had neck cancer, and they had to get their jaw and stuff taken out and radiated, and they end up having a pulling here. And if you can imagine having your jaw reconstructed, great, but then you have a pulling and heaviness here because of all the fluid that's going right here. How are you able to eat? How are you able to talk and engage? And you'll be surprised on just how much food is surrounded, how much food is surrounded by our society, like how much society loves food and how we like to engage in things like that. So it really does take away from your quality of life. So what do you do to manage it? What you do is find a good certified lymphedema therapist, a CLT, wearing appropriate compression clothing and your compression garment, keeping your skin moisturized, and doing the lymphatic decongestive therapy. Lymphatic decongestive therapy is not just lymphatic massage. Oh, I'm sorry. Are we good? Okay,
cool. You're good.
Okay. Sorry. It's not just a lymphatic massage. It's everything. It's the education. It's different exercises. We usually prescribe, if you're able to, a lot of aquatic therapy to help with that. It's so many things that come with it. There's a person on here that said that she has a pump, which is excellent. You need a lymphedema therapist to be able to make that connection, because your doctor most times are not very privy to understanding, okay, once you are diagnosed, you have to be measured, you have to do a certain amount of sessions. They have to see that you haven't technically failed the therapy, but it is a chronic condition, so you can only progress, but you never quite graduate, but you get to the point that you can manage it yourself and then move forward to getting the proper compression pump. And so, of course, anti-inflammatory and low sodium diet and lifestyle is very, very important. That looks different for everybody. Sometimes it's not always just, okay, put away the chips, put away, the salsa. Sometimes it's something else. Sometimes it's just making that adjustment. And you're supposed to have protein, even though you have high protein in your body. People end up having hyponatremia, meaning that they ended up, trying to cut down on protein, but your body needs it to heal. So doing it properly. And then, of course, what not to do. This was a reminder from one of my patients who underwent radiation. You cannot, if you underwent radiation, red and blue light therapy, you cannot do. that includes the infrared and the saunas. I know a lot of people are coming out with the infrared saunas and compression garments and all these different things. Patients that have radiation in the past cannot do that because you'll end up reburning the skin, even with that very, very light radiation. So knowing that it's very important. Wearing too tight clothing that can cause a tourniquet effect, can cause, you know, causing that ballooning and puffing up of the skin. Taking diuretic medications. Again, if your doctor puts you on a diuretic, tell them I said no. I know everything is different. I have a few patients that have lymphedema and CHF and some other things. So, of course, there are certain comorbidities that you may have to take a certain diuretic, but to treat lymphedema by itself and only itself, a diuretic medication is not going to do it. It's just going to make that lymph fluid thicker because it takes away too much water from the tissues, and that can make you have more fibrosis, end up having more infections like cellulitis. Um, do not go to a non-lymphatic specialist for liposuction or for skin reduction surgeries. You are allowed to ask these people who are highly trained, not taking that away from them, hey, what do you do about the lymphatic system? Do you offer lymphatic services after surgery? How do you do your stuff? How do you watch out for the lymphatic system whenever you're liposuctioning, my tummy or my legs or my arms or whatever? You're allowed to ask those questions. And if they say, oh, we don't care about that, run. Run far away and never return from Lion King. Don't do that. So these are things that I would have a conversation with you if you were my client, but now you know, now you have an idea. How to find a lymphedema specialist. Best way to do Google is find lymphedema therapist near me. I have this link right here, and I can either copy and paste it, put it in the chat, or if you need me to send it to you, guys can do that. But you can see all the certifying and training schools, the LANA, people that are LANA certified and directories right in this lymphatic network. To find SDLT LANA specialists like me. But again, LANA specialist means a board certified lymphedema therapist who's considered a lymphology specialist. This is the link too. So I've had patients that found me on that link. Who's like, hey, I want to see somebody who is extra specialized. So I took the course, I treated patients, and I passed the test. And so I'm able to give more insight and more really more insight and pull more literature and research and have a conversation with the patient, with the surgeon, with the doctor, with whoever, and say, hey, this is what this patient needs for lymphology specialists, lymphology services. So types of compression. As you can see, I have a very, very pretty one here, but there are some that you can do that are easy, that you can wrap yourself. As you can see, there are some for your upper extremity, for your arm, for your lower leg, for your thighs, for your full lower extremity, some for your fingers, and even for upper extremity for some of my breast patients that have that pesky, like this right here, that little lip, blesses my soul, because I had that too, that little gathering right there sucks. But it also needs to be able to be compressed as well. So finding the right compression is very, very important. And this is why it's great to find a lymphedema specialist that can actually measure you and get the proportion, just to tell you that. Because if you just go online yourself, you'll just see, okay, large, extra large, medium, and that's it. It may or may not fit. What happens if you change? What happens if you do that? I'm a lymphedema, since I'm a lymphedema specialist, like whenever I do measurements, I always make sure I give or take at least 1 or 2 centimeters, because you may swell. I need to know, like, do you swell more in the wintertime? Do you swell, are you all year round? Even allergies can affect your swelling. I swell more during the spring and winter, and spring and summertime. Wintertime, I'm great because it's nice and cold. It's cool. I can do my massages and stuff, but come springtime, I can tell that my body needs more compression, needs more assistance. So being able to say, okay, hey, you need a springtime compression and you need a wintertime one, because they won't fit at the same time. So making sure you have the right person that will be able to give you the right stuff. an unshameless plug. This is Lymphedivas, as you can see. Fantastic. Hold on, I gotta see myself. Oh, I see the beautiful host. Here we go. This, this is Lymphedivas. So I love them because they're colorful, because they have lots of patterns, and that it matches my outfits. If I feel like, oh, I need some extra help, but I don't want to wear that beige color, I can go Lymphedivas. They have beige, but they also have sunflowers and other things. And I'm scared to get a tattoo, even though I really, really want to. But I love their collections that looks like a tattoo or arm sleeve. And so it just gives me enough compression that I'm able to still move, do everything I can hit them with this here, but I can also, breathe. I'm not itching. It's not too tight. It's not uncomfortable. It's still a very nice, breathable fabric. And so not all compression are made the same or made alike. There are some that are flat knit. There are some that have the sylvadine and things like that integrated into it. There are some that are thicker and some that are tighter than others. So you got to make sure you get the right one. And so what I like about Lymphedema is they have the graduated compression system, that it's supposed to be a little bit lighter up here, a little bit tighter around here, and then going along here to get there to keep that lymphatic system going into the extremities and holding down and being able to cause that swelling. So, but I have some other colors here. I feel like there's always a war on us women. Anyways, so we got to go to war. So I have this fabulous army fatigue 1-2, or military type fatigue, which is great. And I love them because they come in, different sizes, and they have the nice thick band too. And then they have like the diamond band, which I love, to help keep everything up. It's not always sliding. I'm not always doing this and doing this. So as you can see, you can measure yourself or have a lymphedema therapist measure you, but they have a great sizing system. Definitely is pretty awesome. So on that note, would you like to do the drawing, Miss Kelly? Oh, you're on mute. All right. And so that is just the introduction of lymphedema. And I just wanted to just get that information to you guys. So follow me, email me, and also check out my website as well. I have the QR code too, so it takes you straight to my website. So if you have any questions, comments, concerns, please reach out to me. And now I am open to any questions that you may have. I can also open it up on the group chat. Well, but if